All right, so again, welcome to a health topic Q&A for the Black and African American community. And I am your moderator, Belinda Primus. And our panelists tonight, as I mentioned, are Noelle Hoori and Dr. Benjamin Danielson. Any questions that you may have after this discussion or this Q&A, I'm going to ask you to direct those questions to, can you see my slides? Are you able to see my slides?
Yes.
Okay. I'm going to ask you to direct those questions to King County and their website for any questions that you have. And then finally, and I'll put this up again at the end, there are some additional resources that you can use if you are interested in more behavioral health type resources. So I will put this up at the end as well. And with that, I'm going to bring down this slide all right, so let's see here. Bear with me for a second. Okay. All right, so we're going to start with the questions. And so again, please put your questions in the chat and we will try to cover all of the questions within the chat. So let's see here. The first question that we have for the panel is, how do I protect my kids under the age of 5 who have not received the vaccine? So either of the panelists can answer. Dr. Benjamin?
I'll start us off gladly, and also welcome any other comments from you, Noelle. It's good to see you and everyone else. I'm really honored to be with you tonight. And I just want to say I appreciate that we also create space for our Black community to have the kinds of conversations that we should be having. And I appreciate that public health is making this effort. And I appreciate your leadership, Belinda, in bringing this together. In terms of that first question, one thing that comes to mind for me is just that it's important to remember that vaccines aren't the only thing that we're talking about in terms of protecting ourselves from getting sick from this coronavirus. Vaccine is one tool, but it's not by any means the only tool. And we have to think about all the things that we can do to protect ourselves and our loved ones. So of course, the things that we've gotten pretty good at as individuals and as families around frequent hand washing is incredibly important. It's amazing what a difference that has made, not just for coronavirus, but also like limiting the spread of flu virus and other kinds of viruses too. So it's proven itself really well. Wearing a good mask, and I think a lot of us have gotten much more towards wanting to wear masks that are much more like the N95s, maybe a little bit less like the less filtering cloth masks and that we used to have, although doubling up with a cloth mask and another kind of mask can be really helpful. Thinking very carefully about how much you want to be among large crowds of people, especially crowds of people who don't wear masks themselves, is a really important thing to consider and take into account. And, doing as many things outside where the air circulation is so great that the risk of spread is a lot lower. If you are inside, hopefully really trying to be in the places that either have a lot of good ventilation, if you can know that, or aren't too crowded. Those are just a few of the things that I think of, but the list is kind of long, isn't it, of many things beyond vaccines that we're doing to help keep our families and our communities safe. Noelle, I've been talking too much. Is there anything you want to add to that list? Or
Thank you. Anything to add, Noelle?
No, nothing for me. Thank you.
Okay, thank you so much. So the next question is, how many people in our community are currently how many people in our communities are currently incarcerated and have undiagnosed developmental disabilities, how can we address the health issue, especially as it pertains to adults? So that question is for either panelist.
I will start with, I don't know the exact number myself. I think that there are major problems in every community where we are incarcerating people who have needs and abilities and other things that should make it so they do not that they're not actually criminalized for those medical conditions. I think that we have a society that has a lot to account for in terms of the way we have preferentially incarcerated Black and brown people. I know we have 2 million people in prisons and jails around this country. And I know that any one extra person who suffers from a mental health condition and for that is criminalized and then imprisoned, that is a crime on society's shoulders. I also think this time during this coronavirus has possibly been a time for us to ask these questions like you did. Whoever you are who asked that question, I really applaud you for asking it and continuing to ask it in as many circles as possible, because sometimes places of confinement can actually be places where people are more at risk for coronavirus. And sometimes places of confinement can make mental health conditions even worse. So this is a really important time for us to be asking these kinds of questions and for us to be really pushing for meaningful reforms and changes to our prison legal system. That was not a very good coronavirus answer, but I'm proud of a community that is always willing to lift up questions like that.
Thank you so much for that feedback. For the individuals that just joined, welcome. And we are asking that if you have questions, when you have questions, please put them in the chat and we'll be reading the questions from the chat. So thank you very much. I'm going to be moving on to the next question. And that is, why do I need to be revaccinated or boosted? Aren't I already vaccinated? Somebody's asking that question. So why do I need to be vaccinated or boosted? Aren't I already vaccinated?
These are good questions. For most things, actually, that we can be exposed to, our immune system is set up so that things like vaccinations help create an ability to fight off particular viruses and things like that. But over time, that ramped up immune system tends to kind of fade and calm down for that particular virus. So your body becomes less and less ready over time to face that kind of infection, which is, we've been doing this for years with the flu vaccine, right? Every year we need to get another flu vaccine, partly because the virus changes a little bit and partly because our immune system over time, over the course of a year, loses its memory of how to fight off that particular virus. Each virus is a little bit different. There's some viruses, our immune system has a memory that's almost forever. And there's other viruses where the immune system's memory of how to fight that virus kind of gradually goes down, which means that over time you can be sick. You can get sick again if you're exposed again to that vaccine, that virus. So we give boosters with vaccines in order to remind our immune system to maintain on alert for that particular virus. Each vaccine is specific to a particular infectious agent, like a virus. And so vaccines for other things won't protect you against vaccines for against viruses like coronavirus. Only the coronavirus vaccines will protect you for that.
Okay, well, thank you so much for that answer. All right, the next question, I believe, is a mental health question. Do you think mental health is an issue discussed in the Black community? Noelle?
I would like to say that we we have more conversations and that we have healthy conversations about mental health in the Black community, but we do have a fair amount of stigma about what it is to have sound mental health, right? So maybe some of those initial steps of not necessarily illness, right, but just how to be well. And we do have a significant amount of barriers, just being Black in a world of anti-Blackness. So we have the having access again, right, to conversations, to have people that are talking about how we can prevent, right? I come from an early learning background, so infant mental health is one area of specialty for me. And I was just reading an article today about pregnant moms, right? And how stress, like chronic stress, and our babies are already born with a higher level of stress because of social factors, right? So there's higher poverty in Latino and Black communities. And so we're already predisposed to having more barriers to wellness. And so I hope that we can learn and grow and have more positive conversations, and that we can learn to see mental wellness as a part of just like physical health, right? Like that we can't have, they're not mutually exclusive, right? We can't really have one without the other. And so I hope we can learn to have more conversations. I think forums like this are a really great place that we make it community-based, and we have challenges with access, right? Healthcare. Many of us do not have proper healthcare. And even when we do, we have barriers of getting doctors who look like us or don't, but are willing to care for us like 100%, right? And so there are challenges having the conversations, advocating for ourselves, focusing on our well-being so that we can parent in a, from a good place. Those are all really critical pieces of how we do early, like the early work, right? So that we're not constantly trying to catch up with, adults who are struggling or in systems that are not meant, right? They're not meant to support us and support our wellness. And so it's really good for us to have these conversations together, to bring the experts together. I'm very humbled to be in the space with Dr. Danielson. So I just think it's so important for us to look within our community and bolster that and talk about our wellness is important, and that there doesn't have to be stigma, right? There's no shame, there's no blame in mental illness or talking about mental health and well-being.
Right. Well, thank you so much for that information. Okay. All right. Just bear with me 1 second. I am having a little chat difficulty. Okay. All right. So let's move on to the next question. And let's see here. So someone put, my family member is pregnant and unvaccinated. They want to wait until after they give birth to get vaccinated because they worry it will affect the baby. What can I tell them?
My heart goes out for any families facing questions like this. There's so much we need to contend with and worry about, especially as a Black community. We know that a Black mom carries higher risk for every kind of problem or complication, often no thanks to the healthcare system. And so to be facing one more challenge, one more question, like should I get vaccinated before or after I have my baby, it's hard. I just feel for a mom, all moms who are trying to make that on top of every other decision they have to make. I will say that for me, for many of these questions, it almost always boils down to what is the safer path in any situation, in any condition. From my understanding of the way vaccines have been given to pregnant women, and my understanding of the risks of getting coronavirus, the illness itself, when you're pregnant, the risk of getting that illness itself is a really big deal when you're pregnant and could have really important and harmful lasting effects on your child. The studies and the information I've seen so far really seem to say that the vaccine is safe for women who are pregnant. And so all of these hard decisions that every person has to make for themselves, you have to do that kind of thing where you kind of try to balance the risks and the benefits. What is the safest path for me and for my child? And it seems from everything that I know that the safer path is to get vaccinated. And it seems like there's a lot of really good experience now that shows that that's true. But more importantly, I feel for any parent who has to make really hard choices like that right now. And again, Noelle, do you have wiser things than me to say about this?
I don't have anything wiser to say, that's for sure. But I do, I mean, the data is pretty clear about the risk to mom and baby if COVID is contracted during pregnancy. And so it just really, I know that we're leery of systems or leery of, treatments or vaccines, but I think that what the data shows, it makes sense to protect yourself and protect your baby. And I have worked with moms that have made that decision, and some of them have, they haven't gotten it before pregnancy, but I've had a few moms who got it when they were in the hospital. So they ended up with a new baby and COVID, and that's just, it's not ideal. So I think take precautions, educate yourself, get the right information, and make a consented decision.
Thank you both for that feedback. For anybody that just joined, we're asking that you put your questions in the chat, and we will get to your questions by reading the chat. So thank you very much. Okay, we're going to move on to the next question, and that is medication always required when diagnosed with a mental health condition?
I'll start briefly, but I think Noelle has a lot more to say. No, it's not always required. And there are lots of different things that are helpful depending on what kind of mental health condition we're talking about. I also think it's important for us to really just be thinking about the ways in which we're all kind of diverse in the ways our minds and our brains work. And I say that because I think we all need something to help us with stress or strain, with mental health issues, each and every one of us, because we're like thinking and feeling and caring, compassionate people who experience the fullness of this world, and hard things happen. Doesn't mean we need medications all the time, but there's so many other ways in which we can be helpful to each other and help ourselves as well. Sometimes that's having a professional, experienced person that you can talk to and just really talk through what's going on for you. Sometimes there are other ways for us to feel a sense of wellness and healing. I think our Black culture has many beautiful remedies and secrets and stories and ways in which we find healing among us. And sometimes there are times when medications do play a role. But as soon as somebody says there's a mental health issue, I don't think right away that they need a medication.
Okay, thank you. Noelle, did you want to add to that?
Yes, yeah, total agreement. Medication is not always part of the solution. I think when we're looking at like acute illness where we're, ER visits, crisis, whatever that might be, then, in those, again, based on what the condition is, and medication can be part of the plan. But it's a big decision, and there are lots of other, approaches and methods for less acute situations. And knowing that mental health is such a wide spectrum of how it presents, how it impacts life, how comfortable people feel like managing symptoms, and that it's really important to make that decision in relationship with a medical provider is a really good place to start. And that in situations where medication is recommended and an individual wants to go that route, that therapy and medication are really the kind of ideal combination, in addition to, community supports, family support, whatever that might look like. and a team approach, in most things. If you have a network of people to lean on, depending on, is it a debilitating, mental health condition, and you really need to, pull on your supports. And if you're isolated, right, and you have mental health, it really is worth, trying to lean on your community. And so it's not always easy. Everybody doesn't have that, right? And so those inborn pieces are important of, informal support, family, friends, church, in relationship, faith, whatever that might be. And then sometimes for people who don't have that, then those more like medical health, mental health resources are also important.
Thank you so much. I appreciate that. All right, here's a question, another question, pretty long, but so the person saying, since the onset of COVID, King County Public Health has done a good job at establishing and maintaining a number of partnerships with community and faith-based organizations and groups within our community. As COVID numbers subside, what can be done to maintain the partnerships to address other long-term public health challenges in BIPOC communities? Is there a way to expand upon the original premise, mitigating the effects of COVID-19, and address other social determinants affecting our communities?
Such a great question. And I love whoever asked that question. I already know I want to partner with work on supporting our community with that person anyway. But I think that's a really important answer for our question for a few reasons. But the answer is yes, we should be taking advantage of these connections that have been made, the ways in which we built relationship between public health and the community organizations, the community individuals, the community groups that are lifting up community. That's just an important thing. And there's a few reasons. One is, I don't like having to say this, but there are still going to be other waves of viral exposure that we'll be dealing with. Maybe some of them won't be quite as life-threatening, but maybe some of them will be just pretty contagious. And even if they're milder in general, what we know in BIPOC communities is that it just is automatically more severe. So just for the fact that it feels like we're kind of tapering down on our response to the pandemic at this point, it is really much more that we will continue to see some waves come and go. So those relationships are going to need to be there for us to respond to them, especially because we're just going to have to be really nimble, okay, we need to set up another opportunity for vaccinations, in that church parking lot on that weekend. Let's make that happen. Those kinds of things. A second reason is the reverberating impact of COVID will be hitting our Black and Brown communities for a long, long time. And it is not just about medication. It's not just about hospital and healthcare, but it is the devastating impact socioeconomically on the fabric that kind of holds relationships together sometimes, on the many other ways in which this has been just a devastating hardship for our community in so many ways. So it is only wise that we would be really utilizing those strong relationships that we've built now into the future to help support the broader kind of healing that needs to happen. I saw an article in a research journal that was from a psychiatrist a few weeks ago, and they were talking about the best ways that minoritized Black and Brown BIPOC communities can respond to the coronavirus infection. And their conclusion was build better schools, guaranteed minimum wage, high quality pre-K and preschool programs, guaranteed nutritious food for young people. Those answers about what you need to do to get through this COVID pandemic are the answers that should be done around investing in communities like ours to make us even stronger, even more thriving, and let all of our beauty and brilliance radiate across this land.
Oh, thank you. Anything to add, Noelle?
Yeah, I completely agree. And I think if we look at kind of what the pandemic did is it made all of our problems that we had before, I think it allowed us to at least shine a light. Like I work in a school now and I know kids were struggling before, right? But now coming back into the classroom still, we're kind of in the home stretch at the end of the school year and see kids so dysregulated, like not able to like access their thinking brain. So we can talk about how we calm down, right? Just the level of like ability to be able to calm and have a calm state, right? So we can focus on learning and doing all the things that we need to do. It's hard, right? It's hard to access that. It was hard before, and now it's like it's so many more of our kids, right, than who were struggling before. And so it really, I think the beauty of it, if we can take some good out of it, is that we know, right? There's extra funding now in schools. That's where my position came from, is that there's extra funding for schools because we know that the needs are even higher for mental health support and social emotional learning. And so I think we do pushing for change in our systems, right? Our kiddos who have IEPs, so they have challenges with social emotional, or they have learning disabilities or delays, and knowing that those systems are not meant to support our Black and Brown children. It's really not. And who gets them, not equitable, right? And just what that means. So it's an opportunity, and we know that, yeah, this is going to be like, this isn't undone, right? And our earliest brain kids, our kindergartners, our second graders are really struggling. They were the kindergarten babies who were just getting used to school and learning and sitting and all those skills, and then they got pulled, right? They had to go home to not favorable circumstances, many of them, and stressed out parents. And so that we know that last on their brain development, that's not going to go away. And so we really have to advocate for change in our schools, encourage parents to be advocates for their children, and to demand more, that we have systems that are supportive, that we have representation matters. Like my kids see me, they're just like, you could see it in their faces. They're like so happy to see someone who looks like them. The white children at my school are 25% of the population. And so that's huge. Like that's not the world I grew up in, Central Washington in the 80s, right? This is totally different. And so, but the system hasn't changed. The system has not changed. It's the same system. Like we can talk about equity and diversity and inclusion, and we talk about it, but it's not having an impact. So until we push back and demand that the systems change, I think as far as what the county can do is really supporting. There's some grassroots organizations that are already out there that are having these conversations, but don't have the power of like a whole, huge institution behind them, right? Or a government agency. And I think when the people who are doing the work on the ground align with the people that can, move things forward in a, bigger way, and that connection is made, then we can make some change. It's a lot of our parents don't know about advocating, like going to advocacy days for early learning has a day, right? And all these different funding sources, they have days, but they need to see people show up so that the government knows that we're serious about this and we're not going to be passive. So that is what I would say.
Thank you so much. Both of you had great feedback around those questions.
Just by the way, there was a person who asked for the reference to that article, and it's I put it into the chat, but it's JAMA Psychiatry from February 9th of 2022, Dr. Ayanna Jordan, if anyone else would like to look that up.
Okay, thank you so much. Okay, let's move to the next question. If I am on fertility treatments, should I get vaccinated?
Anytime you're doing something really important and meaningful and even a little medically complex with your body, I think it's important to talk with your healthcare provider about that. And that's a really good question to have with your direct doctor or provider who's helping you through that. My sense of it is that they would still recommend getting the vaccine, but that's such an important and special situation. I would really want you to talk with your doctor about that. That would be my input. I don't know, Noelle, if you have a different thought about that.
Thank you so much. Okay. The next question, moving right along, is what are the effects of untreated mental illness?
Again, it will depend on what the mental illness is. I think, I work with kids, so we have a lot of kiddos who get Dr. Danielson, you can speak better to this probably, but kids who everybody has ADHD. You know, if you go to a school and you talk to teachers, oh, this kid has ADHD, this child has anxiety is real in children, and the symptoms of anxiety can look a lot like ADHD. And so that's a conversation I have regularly with parents and with teachers, is that we make sure that we know what we're looking at. Just because something looks a certain way doesn't mean that it is. And so, our kids who don't, aren't treated effectively or for the right condition, that has huge, their development, their social interactions, right? Kids who have a hard time getting along don't have friends, right? That comes with the whole stigma for it. So, relationships are hard with people who have mental illness that's undiagnosed. Keeping a job can be really hard. Getting out of bed and taking care of your basic needs can be hard if you're depressed. And more chronic illnesses. I mean, we have people self-medicating, right? So substance use, people have dual diagnosis of mental health issues and substance use. Sometimes we don't know what came, what came first, but people want to feel better. And we don't always have the best way of doing that if we don't have access to care and conversations and understanding that it's okay to talk about these scary things that might be happening to us. And some people might isolate, people self-harm. I mean, the list is pretty big, but those are the things that come to mind. And it's, at the basic foundation, we're not living our best lives, right? If we're struggling, then we're not getting to learn and to grow and to live and to laugh and do all the things that we should be able to do. And so it takes away from our quality of life ultimately.
Thank you so much. Dr. Benjamin Danielson, do you have anything to add to that?
Only a tiny bit around, because that was such a great answer to the question. Could have so many expansive different responses, and that was really well put together. I think sometimes, especially in communities that face a lot of trauma, there are lots of people who just work extra hard and get by. They just work extra hard to just manage, and they find ways to get by. They find ways to kind of work 3 or 4 times as hard as the next person next to them in order to kind of get through their lives. And it looks like maybe things are going okay in many different ways, maybe still able to find joy and these things, but it is exhausting on the inside, even if it doesn't always feel that way on the outside. And you come and add a coronavirus pandemic to that, and the impacts could be extra heavy, or just when some other stress comes up, it can just be asking just a little bit too much of you, because you're already running on like 99.9% every single day, and you're making it happen. I mean, I really am so impressed with people who manage and do well with different kinds of diverse mental needs, and yet at some point it really does tend to have an effect. And I think that's partly why in America, Black Americans don't live as long and have many other conditions that also tend to accumulate in our bodies. Noelle, does that sound also right to you, that people might not ever actually look like they're having as much struggle, but their tank is just really kind of filled up already? They don't have as much reserve or something.
Yeah, absolutely. And it impacts your resilience, right? Your ability to bounce back when things happen. And people are resilient and they power through some really amazing things. And it still takes away, like you said, quality of life, length of life is certainly impacted.
Thank you so much for those responses. I just want to remind the individuals that please feel free to put your questions in the chat so they can get answered. We're coming up on 6:42, so we just want to make sure that your questions get answered. Okay, we're going to move on to the next question, and that is the COVID vaccine safe for kids with allergies and health issues? What do I do if I have a reaction?
again, I'll start. If you're worried about the chance of having an allergic reaction to the vaccine itself, something in the vaccine, it's definitely a good idea to talk to your doctor about that. So that's one thing that's important. So far, it seems like, allergic reactions to the vaccine itself are extremely, really, really, really rare. So just having allergies alone doesn't make you necessarily have to worry too much about that. But if you are concerned, it's always good to talk with the provider that you trust, somebody that you really feel like you can ask and get good answers from. If you do have general allergies, getting sick in any way is just more miserable for you, right? Even if it doesn't mean going to the hospital, it just could mean a lot more sick days and just feeling really bad. Allergies make every illness feel worse for most people. So it would be a reason to really consider getting vaccinated so that you're not actually carrying that double hit of allergy symptoms plus infection symptoms at the same time. I think that's all I would say so far.
Thank you so much. Let's see here. Mental health question. Is there a way to avoid being diagnosed with mental illness, such as changes in lifestyle, stress level, anxiety, etc.?
This is a big one. I think as far as like avoiding being diagnosed is part of our problem as a people, right? That we don't want to have a mental illness or sometimes even physical illnesses, right? Are there, a healthy, well-rounded diet that doesn't have a lot of, processed stuff in it? Does that help us feel better? Absolutely. Is that gonna be a magic cure for mental illness? I'm not sure. I would say, again, talk to your doctor. I think if seeing a naturopath, a homeopath, if that's really your go-to, then I'd say explore that with a provider. Because I think the things that we believe in can be healing, right? But I know that because of stigma and because we really want to be well, that factor of I don't like to use the word denial, but that we can wish it away, or that if we don't, we have some magical thinking about if we don't go to the doctor. I was just having this conversation with somebody. I'm not going to the doctor's not going to help you if something's going on, right? So it's better to bite the bullet and do it, right? So I would say explore those conversations with someone who can really lead you in the right direction. But yeah, Dr. Danielson.
I totally agree. I was thinking also, Noelle, that it's possible sometimes you might go to talk to a health professional or mental health professional. They might tell you actually they don't think you have something, and you might have been worried that you had a mental health concern for a long time, and then you finally talk to them and they're like, you know what? You are actually, your body's just responding very appropriately to a lot of stuff going on for you, and that is, it can be helpful, reassuring sometimes to also talk to somebody who might be able to allay the worry. It's a lot to carry that worry that you have a mental health condition, and so I was just thinking about that as an added point.
Thank you. Okay, the next question from our audience says, in what ways has COVID affected the Black community? That's a good one, too.
Noelle, I always go first on these. Is that okay? Or I'll try not to be too. So there's a lot of different ways to think about that. One is there was a study that looked at what happened in the first year of the coronavirus infection, way back in the year 2020 or whatever that was. Feels like 100 years ago already. And they studied things and found that life expectancy changed in America. It changed drastically, in a way that hadn't been seen since World War II. Changed for just about every racial category. For white Americans, life expectancy went down in that first year of coronavirus by 1.25 years. On any other normal year, just a change of life expectancy by a month or something is like a big deal. So that's big. However, when you compare that to other populations, it's not as dramatic. Like, for instance, for the Black community, life expectancy due to that first year of coronavirus went down by 3.25 years, like 3 times as much as for white communities. That is devastating. That is getting into the space where grandparents don't get to see their grandkids, and where generations are separated, and where communities are really finding it all too regular to be knowing about somebody around them who has passed. In the Hispanic Latino community, there's almost 4 years of life expectancy that was lost. So if you just measure it in that way, in that first year alone, I think that's enormous. I think that's an incredible harm. And I think racism in society and systemic racism in our healthcare system are the deep factors that made those differences so stark. But there's so many other ways to think about this, right? Like the ongoing socioeconomic effects in our communities that will be so hard to recover from and make us more at risk for all kinds of impacts on our wellness, right? From health issues to happiness issues and everything else, and the ability for us to take care of our next generations and pass on something to them as well. I think the mental health toll in our communities has been especially dramatic and drastic, and we're watching that happen. And I really, really worry that the whole rest of this country will say, we're done with this thing. We're going back to whatever we were doing before, all that racism before. We're going to go back to that. And we're going to have, as Black communities, we're going to have all that old racism, plus all the new effects of these last years of extremely traumatic and stressful coronavirus-based trauma on top of that. So the ledger is not yet fully written on that very, very important question. And we will need to be, I think, our own careful watchers and reminders to health departments, to governments, to healthcare systems, that although someone else declared mission accomplished and coronavirus gone, our Black communities are still going to need support, because it will continue to have an impact on us.
And Noelle, did you want to add to that? Thank you so much, Dr. Danielson.
Yeah, I just think it's so important how we cope, right? All of this has been like piled on for years. And you know, we can't forget that before COVID, we had the anti-Black administration, right? That was in the White House that
Yes.
had its toll, the policies of like isolation that caused isolation in our like undocumented populations, like all that stuff was there. And then we had George Floyd and what seemed to be support. And I don't know how much you've read about it, but that support basically went away. It was like a trending thing, right? Like people were like, yeah, this is huge. And then we're still Black, right? Like we still have all that stuff is still ours. And so to be mindful of how we cope, right? That we're not trying to power through, that we're not self-medicating with harmful things, that we are not being harsh with our children, because it's really hard, when we're worried about keeping them safe, that sometimes we lean towards like a hard way of being because we want them to be, tough so that they can be ready for this life. And when absolutely the kids need the opposite. They need a soft place to land. They need a secure base. They need parents who can, access whatever supports they have so that they can focus on their wellness. And I think that's so important as we look at how are we going to move forward, that we are resilient, right? We are overcomers, and that we think of our children and we think of our elders, and how, collectively we can focus on wellness in a healthy manner. Because I have kids who come to school and they smell like marijuana, right? And this is going to give certain people certain thoughts about this, and that impacts how they're treating our children. And so, just the teachers are like, well, I have to talk to the parents, and knowing that we have teachers who are afraid, because I said it, someone was saying something, and I was like, they're afraid of talking to parents who look like me. That's just put it in the room, right? And so if you're afraid to talk to the parents, what kind of care is this child going to get, right? And so us being mindful of how are we coping, that it's hard, and that the systems are, intimidating, but if we don't try to access them, right, and try to look to people who maybe do look like us and find the helpers, then we're making the work harder on ourselves, and we're putting more of a burden on our children, and they don't need that, right? Systems are already challenging. So yeah, that's.
Thank you for your feedback. This has been an incredible question and answer session. Some really amazing questions have come forth regarding the Black community. It is now 6:53, and I would like to give each of our panelists the opportunity to share their last thoughts. So whoever wants to go first, it's fine.
I'm definitely letting you go first, Noelle.
Yes, no, it's been a pleasure to be here, and I'm hopeful. I'm hopeful, and I think we have to keep our hope, right? We can't get discouraged. We can take breaks, right? We can take breaks because we need to do that, to rest up and keep fighting for ourselves and for our kids, and doing the work of leaning on each other, and not giving up. And this, like I said, I work in the world of children, and so I really I see these beautiful babies every day, and they're brilliant. We have brilliant babies.
Yeah.
And some of those other factors are really keeping them from being able to focus on learning and thriving and growing. And so, keep talking, keep pushing back, keep advocating, ask for help, look for the helpers, and don't be discouraged. Right? That we're out here, we're not going away. Right? Those of us that are doing the work, it is exhausting on a professional level. Kind of being the squeaky wheel, whatever you want to call it. That's not right. Calling things out when they're not right, and continuing to pursue justice, and that it has to start with us, right? We have to be able to take care of ourselves in a way that is going to allow us to be around and to advocate and to work for change. So thank you very much.
Thank you so much. There's one more question in the chat. I think we should get to it. I'm so sorry, if you can just bear with me for a moment. And that is, let's see here. Should pulse oximeters be used as a tool for home monitoring COVID in BIPOC patients? I have no idea what.
Home oximeters can be helpful in knowing when your breathing system, when your respiratory system is not carrying enough oxygen, delivering enough oxygen to your blood, and your blood is not carrying enough oxygen to your organs. I know there's been some studies on pulse oximeters and their usefulness, and sometimes they can create a lot of the kind of anxiety that can make you worry because they don't always work accurately. So I know that's an issue. I think for someone who has an extra condition, it could be really, really helpful if you have asthma, if you have a history of trouble with your lungs, pneumonias and things like that, then that could be a really helpful tool. It feels like that would be a good question to talk with your doctor about based on your own health issues and needs. But I also think that it's not yet proven that having everyone in the BIPOC community go home with a home oximeter is going to be as helpful as you wish it would. There's probably no substitute for having a caring, loving person next to you who's keeping an eye on you and willing to get you to extra care when you're feeling it. Oh my goodness. And there's a beautiful young person. Oh, talk about brilliant. Yes, Noelle. I see the brilliance. I see the abundance. I see the hope.
Adorable.
I see the power. Yes.
Okay, Dr. Danielson, your last thoughts for our panel, for our audience?
I'm so humbled and honored to be to feel like I'm part of this Black community in this area. It's been an amazing gift to be a pediatrician. To many of us are just brilliant, amazing, beautiful young people, and I want to say I'm proud of us. I'm proud of us. We defy the odds every day, every way, just by just by being in so many ways. I'm proud of us, and I celebrate us. And I know, just as Noelle said, we are a place of abundance and brilliance and talent and skill and beauty, and I love that. And I would love to come back and do a question and answer on how come we're so damn wonderful? What makes us so brilliant? What are the things that we get to celebrate as a community? Like, let's spend some time also talking about that. I don't want to run away from the hard things, but I also want to make sure I have a time to put a big hug around the things that make all of you just amazing people. And it's just a privilege to be in space with you and share community with you. And I will always try to be of good service to the community I love.
Well, thank you so much. I'm gonna take you up on that, Dr. Danielson. Okay, well, thank you. This has been a great forum. We need to keep the conversations going and continue to reach out and strive for excellence in our communities. So thank you very much. I want to be respectful of everyone's time. What a lovely little boy, Noelle. How are you? Okay. And I want to thank the everyone that attended today, the Q&A answer session, and we're going to continue to have more of these. And with that, I want to say good night to everyone. Have a wonderful rest of your evening, and thanks so much from the panel for your service tonight. We really appreciate it.
Ashe, ashe.
Okay. Bye-bye.
Thank you.
Bye.
Bye-bye. Hi, Pastor Lee.
See you, everybody.
Hey, Derek.
How are you?
Good night, y'all.
Good night.
All right, thank you.
Thank you so much. It's been great. Bye-bye.
Good night.
Good night. I'm going to end. When I end, it all ends. So
Yes. Thank you, Belinda. Hi, Julian. How are you, puppy? How are you?
how old is he?
How old are you?
5. Oh, he's adorable. The only one?
Oh, no. He's got two big sisters. He broke in. I don't know how he got in. The door was locked.
Oh, that's perfectly fine.
Oh, he used the penny. Apparently, that's how you get it.
That's perfectly fine. Well, I appreciate your time. Wonderful, wonderful discussion tonight.
I enjoyed that.
Hopefully we can
Thank
do
you very
more.
Thank you, Noelle. Thank you, Belinda. We'll talk tomorrow.
Okay,
care.
then. Good night, everyone. Bye-bye.